Thanks so much for joining us today and for giving me the invite to present today. So my name is Dr. David Barber, and I'm a family doctor with the Department of Family Medicine at Queen's University, and doing a bit of research as well. I've been using AI for over a year now, and have been involved in some of the studies, especially in family medicine. What I'm going to say today is really, it's opinion, and I'm going to try and keep it real. There's no real evidence yet in a lot of this, so it's opinion, but it is front lines. This is my view from spending time with patients and with our medical residents. 15 minutes is not a lot of time to do the AI realm justice. There are just, there's so many different opportunities, so many different possibilities, and we're really just at the beginning. But I'll try and pick out some of the highlights that I think are really quite important. There are a lot of issues in family medicine these days. I mean, people talk about the crisis of family medicine. Close to 3 million patients without a family doctor. And the question is, what happened? I mean, there are a lot of different reasons. There's no single answer as to why we're in this crisis, but we can point to a few what I think would be culprits. So this is a really interesting. This is from 2013, and so it's a drawing done by a 7-year-old girl after her appointment with her family doctor or doctor. And gave it to the doctor after the visit or later on. And it's really to me, it's actually very sad. Like, it's a very, very sad thing to see, right? Where she sees, you can see here, and it's blown up, but the doctor facing the wall, the patient is sitting on the table, and there's just no communication at all from the family doctor. To me, is sad and striking, and that's one of the negatives, about using electronic medical records. I think that it's one of the things that has really made us more inefficient altogether. And I think what really happened is EMRs came in, and I think that people thought that it was going to be a time saver. There was going to be this magic bullet that it was going to make the whole system better. And in some ways, I would maybe argue that. It's made it more challenging for doctors. I think we really, in some ways, become, glorified typists. It's where does the data come from? Well, the problem is that we're the ones inputting the data, and it's caused a lot of struggles. This is an article that last picture was from an article in JAMA, so that's back in 2013. This is Atul Gawande, an article in the New Yorker from 2018. Why doctors hate their computers, and it's centered around electronic medical records and how it's taking away from care that it should be given, and interfering with the relationship with our patients. And so certainly there are detrimental effects to having an electronic medical record. When we're looking at the number of unattached patients in Ontario, there are multiple reasons for that. Having to use an EMR certainly takes longer, so we can see less patients. Certainly, the world is more complex, diseases are more complex, and so we're having to spend more time with our patients. But we need to figure out how to fix this, especially around the EMR. And if you think about it, back in maybe 20 years ago, or maybe 30 or 40, the documentation was really done on cue cards. Like, a doctor would write on a cue card the notes, and that was it. And interestingly, about 10 years ago, I met up with a doctor who worked up north, and she told me that she didn't use an electronic medical record, and I was just flabbergasted at the time. I was like, really? You're not using, at the time I thought it was crazy. But looking back, I mean, you can kind of understand, why. It's just easier to write. You can spend, more quality time with your patients, and it's easier. You lose a lot of the benefits of population health, but in some ways you're doing what you're supposed to be doing. So, the question is, really, can AI help here, right? can it help with this problem? If you look at this next slide, this is, this will be one of the challenges actually, getting AI scribes into the hands of doctors. I'll talk about that in a bit. Actually, they're missing a slide here. Okay. So this is a really interesting piece. So this is a study done by Dr. Joanna Wilms, who's a family doctor in our community. And she was interested in hiring an AI medical scribe, an actual person, and this is back in 2023. And so what she did is, to see the value of it, she did a time motion study, so meaning she had somebody follow her around and document to the minute what she was working on during the day. So this is recorded a total of, I think, 60 hours. And you can see the breakdown, and it's really quite striking. To me, the biggest thing is the green part where 30% is spent face-to-face with patients. That's it. 30% of her day is face-to-face, and so 70% is non-face-to-face. Is all the administrative work, all the stuff that goes on in the background. Really quite shocking, right? And so if we're going to make our system more efficient, if we're going to reduce the number of hours that we're, doing all this administrative work, which has been calculated to be about 19.4 hours per week per family doctor. That comes from the Ontario College of Family Physicians. We need to figure this piece out. And, AI scribes, can certainly help in this case. I think that the main thing is, if you look at AI scribes and how we're using it, it might be helpful to describe what happens at the front line. And it really is, it's one of those technologies that is kind of mind-blowing. And literally when the patient comes in, you pull up your electronic medical record, your EMR, and then there's on the side, there's another program, which is your AI scribe. And essentially, you get permission from the patient, and you click the record button, and the magic happens. And then at the end, you press the button, and this beautiful note is generated, and it really is quite something to see. But it fits nicely in with our current flow. It's not that there's nothing technical about it. It just works. And then you copy and paste it from one program to the other, and that's it. So, and you may be saying, so what? Right? Like, who cares? Like, it's a note. But there's a couple things. So one, like, I really, really hate typing and documenting. Like, I just can't stand it. And the idea, and I never, when I'm with a patient, I listen to the patient. I don't type, and so I have to type my notes afterwards. But to walk out of the room and have the note already created, it gives me a sense of joy, right? Like, it really does. Like, I'm just like, wow, this is great. In fact, to the point where I've actually, and this is true, I've had nightmares where I forget to press the record button with a patient. Like, no, I'm serious. And then at the end of the visit, I start to panic. I'm like, oh no, I've got to write the whole note and all that, right? And that's how powerful this has been for me. In terms of evidence, Ontario MD did a recent study, and they looked. They had scribes in, I can't remember how many practices, but the savings were about 4 hours per week, which is not a small amount, and reducing documentation by 70%. And so that's really, really significant. And I'll say that my experience isn't unique. I mean, I hear this bringing the joy back, and it's the freedom to be able to kick back and look at the patient in the face and have a conversation is extraordinarily powerful. So what other benefits are there to using the AI scribe? So you certainly get more complete notes, right? My notes were always quite short. You get a better record of the visit, and that's always a good thing for questions that might come up later. I think it's really important, potentially for medical legal cases as well. You have better documentation of the whole visit. It'll print out a list of to-dos, right? And so, doctors are not perfect. I mean, we forget stuff. I hate to admit it, but I've forgotten to order some tests. It just slips the mind. But with this, there's a list there that I can check and make sure that I've done everything at the end of it. For the patients, the patient benefit, I mean, certainly having, being listened to, I think, is really powerful. And I think Dr. David Walker, said as much. And it's a bit of a different experience, a better experience, I think, for patients when they see a doctor who doesn't have to take notes and face the computer the whole time. There's other benefits. At the end, you can ask the scribe to create an after-visit summary for the patient, which is really quite helpful. And this is really just the beginning. One of the things that we're moving towards is going to be the integration. Right now, these products are separate, right? So you have your scribe, and then you have your electronic medical record, two separate programs. I was just talking to our vendor yesterday, and now they've integrated the scribe into the electronic medical record, meaning that the AI scribe has access to all the information about the patient, and that opens up different possibilities. I mean, that opens up creating insurance summaries for patients. It can start to order. In fact, this is one of the features coming out. Order labs for you based on your interview with the patient. It can write prescriptions. It can create referrals to specialists. And so these are the kind of things that just eat away at you during the day. And to have those taken off your plate, to me is really quite significant. And if you want to push the boundaries a bit further, imagine a future where patients can use an AI tool to interface with their own patient records, right? So you could, as a patient, you could go in, enter your EMR, you can pull up all of your data, and then you can ask, the AI agent, tell me, how's my health? What am I missing? Are my screenings up to date? And how, should I see, there's anything I should be seeing the doctor about? And there's no reason why, if a person has a chronic condition like diabetes, there's no reason why the scribe couldn't say, well, you're due for your next blood test for diabetes. I'll go ahead. Do you want me to order that? I'll go ahead and order it like that. I don't need to do that. That can be taken off my hands completely. So you can see this is going to snowball and have bigger effects over time for sure. So efficiencies are going to be, we're going to see a lot more of those. I did want to talk about this in terms of challenges. This is going to be the biggest challenge. It's going to be to get doctors in general to start using scribes. I don't think doctors are scared of technology. But I mean, we still use fax machines, which isn't a great thing. So we need to do better. And if you look at, this is Rogers' diffusion of innovation theory, and we're just at the beginning. So we have the innovators, probably like myself and the early adopters. We're getting there, but there's a lot of work to be done to get this into the hands of doctors, so that we start using it and create more capacity in our system, which is really the only solution to getting everybody a family doctor or attached to a primary care provider. So the next piece that I want to talk about, like, to me, this is a bit of a game changer. It's really about using AI as a decision support tool. And so I don't know how many people read these articles, but so the New York Times and the Washington Post, about every month, they have, and the New York Times is called Diagnosis. It's by Dr. Lisa Sanders. And essentially it's a case, a medical case that's been really hard to diagnose, sometimes taking decades to diagnose patients. And so it gives a whole history, what the patient's what they've gone through. And at the end, they finally see, some doctor who magically figures everything out. The Washington Post has the same thing. So I took this case and I plugged it into, I took the history and I plugged it in to ChatGPT just to see, what it would come out with. And I did it for about 10 different cases from both the Washington Post and New York Times. And it pretty much nailed it every single time. And which is really, quite amazing. And you can see It's going to help, that's going to help patients. To what extent, I'm not 100% sure, but I think that this is going to be really quite an amazing thing. And certainly, we can find diagnoses that have been missed. In fact, there's a company right now that if you let it go into your EMR, it'll search for patients who have missed diagnoses, right? And then let you know, I think you've missed this. And then certainly, I'm sure there are patients where there are misdiagnoses in my clinic. Hopefully not that many. This is really, you can see the recording up on the screen. And so the first differential diagnosis was the answer for this. And this is something that took 18 years to solve, right? So these are not easy cases by any means. At the minimum, AI is going to be a really useful tool in this respect for doctors. For patients and using it to plug in their symptoms, I think, that makes a lot of people scared, I think. In fact, I was thinking that it's very similar to what happened when Google came out maybe 15 years ago. And I remember doctors at the time were saying, this is going to ruin us. Patients are going to Google their symptoms and it's just going to take so much time. I would argue that it's actually been a good thing. I mean, there's no doubt there are some negatives. I think the biggest negative are patients Googling things and then getting anxious about what they see. But in general, when I see a patient getting involved in their own patient care, that's only a good thing. Like if you're involved in the care that's provided to you, I guarantee you're going to get better care. And I really see AI in the same way. I just think it's going to empower patients, and I think that's just is so important. The more that we can do that, the better off we're all going to be. So what about the risks? One of the risks is around this. So this is a list of all the potential diagnoses for fatigue, right? So when a patient comes into my office and says, I'm tired, really I should be thinking about this list of, one of these has to explain the fatigue, right? But how do you even get there, right? And normally the way I think most doctors approach it is that you identify the 5 conditions that explain 95% of the diagnoses, right, for that fatigue. So you can't investigate every single. It's not practical. Usually we have there's a standard kind of workup. There's a very, very thorough history. You do your initial workup, and then depending on your clinical judgment, you would make a decision whether to continue to pursue trying to find the cause of the fatigue, or you just or you watch and wait, which is a reasonable thing to do. What I get worried about is when patients start to use AI to try and explain, let's say, their fatigue, and then they come up with all these really quite rare diseases that they want worked up for. In fact, it just happened yesterday in the clinic where a patient came in and typed all their symptoms into the EMR, and they suggested she might have lymphoma, and so she wanted to be worked up for lymphoma. But you can see that this can get out of control quite quickly. I mean, it would just absolutely overwhelm the system if something like this happens. So we need to be mindful of that for sure. In terms of risk, I think the opposite here is possible. I think there's a risk to not using AI, right? I think I get a bit concerned about regulation, and potentially regulations could slow down the adoption of AI. I would say this is similar to my research with patient medical records. The privacy laws, strangle research in this area oftentimes, and so we just need to be mindful of that. And the last risk I'll talk about, and this is a bit out of my scope, but so if you don't, one of the things is the biggest risk is of AI doing things that it shouldn't be doing, or you don't want it to do, or you didn't ask it to do. So this is a study from actually it was from OpenAI, who developed ChatGPT, And they asked the agent, the ChatGPT agent, to solve a CAPTCHA. And because they can't solve the CAPTCHA. The CAPTCHA's on the right side, where you have to figure out how many lights, are in a, traffic lights are in a picture and click on the squares. But the AI can't do this yet. And so what it did is it reached out to a TaskRabbit, to some service, hired a human, and asked a human to figure out the CAPTCHA. And the worst part about it, is, and I have to read this, is that it thought about what it should do, and it decided to lie, right? Because the person and the jackrabbit said, I'm just worried, I'm just checking, are you a robot? And the AI agent thought about it, says, I have to lie. And so it said, no, I'm not a robot. I have a vision impairment that makes it hard for me to see the images. That's why I need the CAPTCHA service. So that, to me, is really scary, right? That's where something that it takes on its own kind of agency. But, that's what it was told to do, and this is what, AI does. It just, if you give it a task, it's going to do it, even if it has to lie sometimes. So I'm going to stop at that piece. I mean, it's all very scary. This is all very real, but it's all coming, and it's coming fast, and we need to be ready, and we need to get it into the hands of doctors as soon as possible. So thanks very much.